Welcome to a presentation for the patented oral ventilation medical device. I am Dr. William Hart, a lung and sleep medicine specialist representing OPAP Incorporated. The mission of OPAP Incorporated is to design, develop new patented technologies which support life in breathing disorders. I invented a simple and intuitive medical device to improve breathing for men, women, and children who suffer from breathing difficulties. Our product is an oral ventilation medical device which for the purposes of this presentation will be referred to as the O-Vent. The patented O-Vent medical device is used during sleep for the treatment of a life-threatening condition called obstructive sleep apnea. Apnea means lack of breath. The O-Vent medical device has additional potential uses in other applications such as for emergency medical services, during anesthesia, and in hazardous breathing conditions. The exciting current potential is for its use in a billion-dollar market for obstructive sleep apnea. Obstructive sleep apnea is a life-threatening condition which has no known cure, and in the 30 to 60 year age group, it affects up to 4 to 6% of the U.S. population, making it as common as asthma and diabetes. In the age group of 60 and older, the prevalence can be even higher, up to 65% in this group, and the disorder occurs in children at about 1%. There are similar prevalence rates in countries around the world. This model shows the main culprit causing life-threatening sleep apnea occurs when the tongue muscle collapses into the back of the throat during deep sleep. This results in a brief but significant episode of suffocation that deprives the body of oxygen. Oxygen can't get down into the lungs. The only remedy to prevent suffocation from apnea is to awaken from sleep, to partially move the tongue out of the way. These awakenings can occur up to 150 times per hour of sleep in severe cases and may not be remembered by the person suffering from sleep apnea. Snoring is often the first clue that this is occurring. Loss of sleep by these frequent awakenings causes sleep deprivation, and the episodes of hypoxemia or lack of oxygen cause associated risk for hypertension, stroke, and congestive heart failure. This video clip depicts a patient shown on a previous PBS documentary about our first patented medical device called the OPAP. This person is being introduced to the current standard of treatment of CPAP, which blows air through the nose to open the throat. It consists of a mask with straps and headgear that is tightly applied to the face and is worn on the head at night during sleep. Her reaction is not uncommon with the initiation of nasal masks. The current delivery system nasal masks are perceived to be uncomfortable, associated with facial mask pressure, skin irritations, air leaks, claustrophobia, and poor compliance. Our first solution for obstructive sleep apnea is the patented and FDA-approved OPAP device. This oral delivery interface connects to existing CPAP and bilevel machines and is a replacement for cumbersome nasal masks. The OPAP is the foundation for the development of all our new devices, which will be mentioned later in this presentation. Here I am describing how the delivery of air pressure delivered directly to the back of the tongue opens the airway by the way of the patented OPAP oral chamber. This is held in place in the mouth by the teeth. I invented this method based on studies which show patients prefer an oral device 4-to-1 over a nasal mask. No straps are required, and no pressure sores on the face occur, and no air leaks occur around the mask. The OPAP device is intuitive to use and readily acceptable. Let's listen to what she says about this device.
Yeah, this is terrific. It's like the retainer I used to wear in high school when I had braces.
This person now shows us how easy it is to apply the oral device and go right to sleep.
If you are a physician treating patients with sleep apnea and would like to know more about OPAP, our mask-free oral CPAP interface, then please call Dr. Jonathan Greenberg at 888-31-SNORE. That's 888-31-SNORE, 888-317-6673.